Hey guys, I'm Dr. Joe Friedman here with ICE Clinics in Kennewick, Washington, and today we're going to talk a little bit about disc herniations. Now, these are a pretty common injury that we see here, especially in middle-aged and older patients, but they can happen in younger people as well. In fact, about a third of the population by the time that they're 20 will have multiple disc herniations in various places of the spine with zero signs and symptoms. So really what's important are the symptoms that are associated with your disc herniation, and those would be things like radiating pain, so pain that might start here in the spine and radiate down the leg. That's commonly called sciatica or radiculopathy, and the numbness, tingling, pain, and weakness that those can cause. So with anything that we're about to go over here today, if they make those symptoms worse, definitely seek out a professional and get some help there, get an exam done. Don't continue doing them if it makes your pains worse. So most of the time, disc herniation in the lumbar spine, the lower spine here, is going to happen at, this is L5, 4, and 3. So this is the peak of the curve, and so it's going to happen in two different places. We're going to have it at the peak of the curve here at the disc at L3, and also where all the weight sits in your spine at L5 and the top here at S1. So these are places that commonly get compressed, and it can damage the discs and force them to the nucleus pulposus in the middle of the disc to go posterior and to push into the spinal cord. That's the most common way that discs herniate, but they can actually herniate in a variety of directions. And so one of the biggest things that we want to do is find positions of relief and avoid positions that make things worse. So let's go over a couple of ways to do that today. We're going to start very gently here. I'm going to be face up on the table, and I'm going to put myself with my knees bent here. This is called a full hook lying position. And what we're going to do are some very gentle pelvic tilts. So I'm going to tuck my tail under and hold, and I'm going to stick my tail out and think arch your back. And then I'm going to tuck my tail under, and I'm going to stick my butt out. And once this feels pretty comfortable, you can start going a little faster and a little more fluidic here. I usually shoot for about 30 seconds to a minute as opposed to a certain number of reps, but that is entirely up to you, and you should just be going to where your comfort level is. It should never hurt more than about a 3 out of 10 or less on a pain scale. From here, we're going to flip, and we're going to go face down. I'm going to put my elbows directly under my ribs here, and first we're just going to hang out here. If this is pretty comfortable, then what we're going to do is progress this, and it might cause a little bit of pain here in the low back. I'm okay with that, as long as there's nothing going down the leg. So if we can then get to a position where our elbows are directly under us, my low back, my belly and belt line are nice and relaxed. This is called a McKenzie prone extension. And we're gonna hang out here really as long as we need, but I usually recommend about 2 to 3 minutes at a time. And after those 2 to 3 minutes, we're gonna do some pumps. So I'm gonna relax down here and push up through my arms. Push up through my arms. And I might do 10, 20, or 30 of these. What we're looking for is if you have pain that goes all the way down the foot, it should then come up to, say, about mid-calf, from mid-calf up to the knee, knee up to the back of the thigh, and it centralizes to that low back spot. If it sends pain continuing down the leg, then it's something that we're going to want to try to avoid. The last one is going to be a real lifesaver for those of you who experience radiating symptoms, especially while seated on a plane, in a long car ride, something like that. And it's very simple to do. So one of the easiest ways to apply traction to your low back is just to use gravity. So what I'm going to do is make 2 fists here with my hands, and I'm going to put them right beside my butt, arms nice and straight. You see how my shoulders are shrugged up high? I'm going to push those shoulders down, and I'm going to try and just relax my low back. Now, some people will say they feel a bit of a stretch here, or it might make their pain symptoms a little worse initially. That's okay, as long as, again, that radiating pain doesn't get any worse. And then from here, after about 2 to 3 seconds usually, I'll have patients kind of relax as a tester, slowly let themselves back down. And if it doesn't make their pain worse, and they can hold themselves up this way for up to 30 seconds or a minute at a time. So this is great because it requires no equipment. You can do it really anywhere that you have a bench, and as you can see, I can kind of just press myself up, hold for 2 or 3 seconds, and gently let myself back down and press back up and back down. And I might repeat that for anywhere from 10 to 20 repetitions there. So if you've been having low back pain associated with some radiating symptoms going down the leg, give those a shot. As I said, if they make things any worse, come in and see us here or seek out a chiropractor or physical therapist in your hometown. I'm Dr. Joe Friedman with ICE Clinics. Thanks for watching.